A mother who's given birth to 44 children has been barred from having any further children by her husband. The year after she was married off at the age of 12, Miriam Nabatanzi became a mother to twins. Following that, there were 5 more sets of twins, 4 sets of triplets, and 5 sets of quadruplets. Miriam has given birth to 44 children, 38 of whom survived, as 6, unfortunately, perished. As a result of her abnormally large ovaries, her body was prone to hyperovulation. Her husband abandoned her 3 years ago, leaving her to raise their 38 children alone. She is now 39 years old and lives in Uganda. Her family has been forced into poverty, a village surrounded by coffee fields. 31 miles north of Kampala is home to her and her children. They live in 4 small cement block cottages with corrugated iron roofs. Before we continue, please subscribe, hit the like button, and click the notification bell for more amazing stories to come. Doctors have intervened to prevent Miriam from having any more children now that she's 40. She claimed that the doctor told her, "I cut your uterus from the inside." After the birth of her first set of twins, she embarked on an epic string of pregnancies that lasted for years. When she visited a doctor, it was discovered that she had unusually large ovaries, which was concerning. He warned her that birth control drugs could cause health issues. Still, the children kept coming. In Africa, the average family size is larger than ever. According to the World Bank, Uganda has a fertility rate of 5.6 children per woman, more than twice the global average of 2.4. Miriam's 38 surviving children likely make hers the largest family in the country. Physician Dr. Charles Kigundu of Mulago Hospital in Kampala told the Daily Monitor that the most likely cause of Nabatanzi's extreme fertility is inherited. She has a genetic predisposition to hyperovulate, meaning she releases multiple eggs in one cycle, increasing the chance of multiple births. Her last pregnancy, 3 years ago, was complicated. The twins, her 6th set, were born prematurely. One died shortly after birth, becoming her 6th child to pass away. Soon after, her husband, often absent for long stretches, abandoned her. His name is now a curse in the household. Miriam refers to him only as he, often with an expletive. In an interview at her home, hands clasped and tears welling in her eyes, she said, "I have grown up in tears, and my man has put me through a lot of misery. Every waking moment is spent taking care of my children and working to survive." With no other option, Miriam turns to every possible source of income, from hairdressing and event decoration to collecting and selling scrap metal, brewing local gin, and preparing herbal medicine. All their money goes to food, medical care, clothing, and school fees. Proud photos of several children who've graduated from school hang on the dingy walls, decorated with gold tinsel. Her eldest son, Ivan Kabuka, 23, was forced to drop out of secondary school due to a lack of funds. "Mom is overburdened, and the work is crushing her," he said. "We help where we can, cooking, laundry, but she still carries the whole weight of the family. I feel sorry for her." Miriam's desire for a large family has roots in a tragic past. Her mother abandoned the family 3 days after Miriam's birth, leaving her father to care for her and 5 older siblings. When he remarried, Miriam's stepmother poisoned the 5 older children, mixing crushed glass into their food. All of them died. Miriam survived only because she was visiting a relative. "I was 7 years old, too young to understand what dying really meant," she said. "Family members told me what happened. From then on, She dreamed of having 6 children to rebuild the family that was destroyed. Providing for 38 children is a constant challenge. One small room with grime-caked walls is home to 12 children who sleep on metal bunk beds with thin mattresses. Others sleep on shared mats, while the rest lie directly on the dirt floor beneath their bunks. Social media reacts. Iffy, Motto said, "She's a true heroine in every sense of the word. She should be inducted into the Guinness Book of World Records. The Ugandan president should support the family. This must be recorded in history. Only God can do such things. When we speak about Uganda's history, she will be remembered." Natasha Ibrahim added, "I pray Allah blesses her and her children. With one child, I can barely stay afloat. I admire that she always comes home to a party of kids waiting for her. What a blessing." Marianne Delaney said, "She's beautiful. Her kids are healthy, but they must get financial help. Early marriage should be legalized, but laws must be improved. God bless them." Jayanthi Sitha wrote, "I don't see anything glorious about this. Can they give their children a good life? Having babies isn't the only step. We shouldn't ruin someone's childhood or future. I feel sorry for those kids." Another mother of 17 speaks out. In a recent post from Viral Story, another mother who's given birth to 17 children said she still wants more. In an interview with BBC News Pidgin, the 47-year-old woman revealed she has always had easy pregnancies, with just one child delivered via surgery. Dumaya said she's only been to the hospital twice for deliveries. The rest were at home. Sadly, 7 of her children passed away, leaving 5 girls and 5 boys. She was married at 14 and often shocks people when she tells them how many children she has. Understanding ovulation and hyperovulation. Ovulation is the release of a mature egg from the ovary, typically once per menstrual cycle. It usually occurs about 2 weeks after a period. The egg survives up to 24 hours, if not fertilized, after which the cycle continues. Hyperovulation, multiple ovulation, is when both ovaries release eggs in the same cycle, increasing chances of twins, triplets, etc. Causes may include genetics, medical conditions, fertility treatments, or stopping birth control. Some cycles may not result in ovulation at all, known as an ovulation. Fertility tracking. Tracking ovulation helps with planning pregnancy, avoiding pregnancy, understanding hormonal patterns. The Cycle Matters Hub offers educational resources on ovulation, menstrual health, and fertility. Binding bonds through beautiful tales. Thank you for watching.